allowed to choose their own treatments.
Table of contents. Should patients be able to choose their own treatments? Amphetamine mechanism. Sarah's experience. Current parallels. Opioid mechanism. Tyrone's experience. Marion and Harry's experience. Why do people fall into addiction? Role of medical practitioners. Treatment for addiction. Argument for patient's choice.
In this group presentation, we will be exploring the film Requiem for a Dream and using it to address the question, should patients be able to choose their own treatment? We will be looking at the balance between giving patients autonomy to choose their preferred treatment, whilst also using medical knowledge to decide the safest and most beneficial treatment for the patient.
Amphetamine is a central nervous system stimulant that functions by increasing the amount of dopamine in the synaptic cleft through a variety of mechanisms. Amphetamine enters a presynaptic axon terminal either by diffusion or by the uptake of the monoamine transporters DAT, NET, and SERT. Once inside the presynaptic terminal, amphetamine increases the amounts of monoamine neurotransmitters in the cytosol through the inhibition of vesicular monoamine transporter 2. Amphetamine also inhibits the metabolism of monoamine neurotransmitters by inhibiting monoamine oxidase. At the same time, amphetamine stimulates the intracellular receptor TAAR1, which induces the internalization of DAT. The net result of this activity is increased efflux of dopamine into the synaptic cleft and reuptake inhibition in the synaptic cleft through the DAT internalization and direct competition.
Sarah is shown as being isolated from the start of the film, missing her deceased husband and having a strained relationship with her son Harry. She has poor self-esteem and body image and tries crash dieting to lose weight, but is unsuccessful. At the recommendation of her friend Ray, she sees a doctor who prescribes her amphetamines for weight loss. She is given little information about the side effects and potential harm, and quickly develops a tolerance to them, leading to addiction. She starts adjusting her dosage herself, taking multiple pills and in different orders, which leads to amphetamine-induced psychosis and hallucinations. She is an example of when patients shouldn't be allowed to pick treatments themselves, as they have no education on the effects of prescribed drugs. Had she known about the risks, she may not have chosen to use this treatment, or sought medical advice when she started experiencing negative symptoms.
Over the last 5 years, there's been a sharp increase in the number of prescriptions for weight loss drugs, particularly GLP-1 receptor agonists like Mounjaro and Ozempic. This has been beneficial for many patients who have struggled with weight loss and been unsuccessful through diet and exercise. However, there has also been a rise in online prescriptions for these drugs. It's possible for people to fill in forms online and receive a prescription from an online pharmacist or doctor and begin paying for and receiving these drugs. Whilst this has benefits, including reducing wait time to see a doctor on strained health services, it's become an abuse system. There's very little regulation on these services, meaning it has become possible for people to lie about important information, including current weight and diet, so they get prescribed these medications. People who are not classified as obese or in an at-risk group, and so will not be prescribed these medications from their doctor, are now able to access them online and self-administer them if they want, a form of patients choosing their own treatments. However, there's very little information given to these people, including side effects and how to deal with them, and information on safely coming off the medication whilst maintaining the weight loss. Drugs like GLP-1 receptor agonists have big risks, including causing thyroid tumours, which may be cancerous, yet many are not adequately warned about this, and instead, patients are focused on the weight loss benefits. This is perpetuated by the media, where celebrities and online figures are constantly critiqued on their body and weight. This influences the population's opinions and behaviour, making them want to be like their famous idols. They will access and take medications to become more like them, and disregard any negative effects or potential harm. This is similar to what Sarah experiences, where the approval from her friends fuels her want to continue losing weight, and therefore taking the pills, despite the potential harm Harry warns her about. External medical supervision is needed for all medications, including weight loss drugs, where many patients taking them will struggle with body dysmorphia and not be satisfied with results they had once thought were sufficient. This can lead to reckless consumption and overuse of drugs.
Heroin, due to its high lipophilicity, quickly crosses the blood-brain barrier after injection and is metabolized into 6-monoacetylmorphine, and then morphine. Morphine acts as an agonist, binding primarily to mu-opioid receptors, which are involved in pain perception, reward, and autonomic control. By binding to GABAergic interneurons, heroin inhibits the release of GABA. This inhibition leads to an increase in dopamine release within the brain's reward center, causing intense pleasure.
Similarly to Harry, Tyrone sees selling heroin as a way to change his life. He seeks his mother's approval and wants to leave the area he lives in. He also struggles with heroin addiction, leading to him being caught in a shootout and arrested during the film, and later being incarcerated. In prison, he is forced to undergo tough physical labour and is psychologically abused by prison guards. During this, he is also detoxing from heroin and undergoing strong withdrawal symptoms. He has no access to treatments that can help with addiction and withdrawals like methadone. If he had been offered this, would he have accepted? Doctors cannot force patients with addiction to undergo these treatments. It is the patient's choice. Many stuck in the cycle of addiction and used to the lifestyle of repeatedly trying to obtain and use heroin may be unwilling to change this.
From the start of the film, Harry is shown to have been struggling with heroin addiction, resorting to stealing from his own mother to fund this. He falls into classical gender stereotypes of wanting to be a provider for his girlfriend Marion, claiming he will earn enough money through selling heroin that Marion will be able to open a clothing store and sell her designs. Whilst it isn't clear what started Harry's heroin use, we see his dependency progress throughout the film, and he makes progressively harmful decisions, including pressuring Marion into prostitution. This culminates with Harry developing gangrene in his arm from repeated injections. He ends up in hospital and has to have his arm amputated. This shows the risk of uncontrolled drug use, as well as other potential long-term effects like collapsed veins and spread of infections like HIV. On the other hand, Marion has access to money, but not genuine familial care or independence, and this access to the money is conditional. She sees Harry's freedom from his unconditional mother's love, as well as his drug addiction. Additionally, she has her own fashion ambitions, and all this together would create a conflict of anxiety, emptiness, and the need for escape. Therefore, heroin would likely function as emotional relief, a sense of control, and a connection between her mind and body, as well as a connection to Harry. Through the suggestions that Marion has a rocky relationship with her father, it can be viewed how much Marion relies on male validation within her life. It is likely that this is one of the factors that led her to taking heroin in the first place, as well as she probably continues to stay in this way as she is comfortable with a man being in control of her. This likely fed her addiction, as when she ran out of ways to get heroin, she easily took the role of prostitution to gain money. Here she was also taken advantage of by a medical professional, her own psychiatrist. This, therefore, can disrupt her autonomy surrounding treatment, as it must go beyond offering the choice, but treatment must also require structural support systems that both help neurological impairment as well as social vulnerability.
We can see many ways in which addiction can arise, through both trust in the medical authorities and the complete lack of it. For Sarah, the drugs she was prescribed for weight loss were carelessly chosen and given by the doctor, especially for a patient whose reasoning behind the weight loss was not healthy to begin with. Furthermore, for someone as trusting as Sarah, both seen with her son, the TV show, and medical authority, it is clear a longer and more in-depth talk about treatment options was likely necessary. Another worry is the lack of care shown for follow-up treatment. We can see this even further with Marion's psychiatrist using her as a prostitute, when he is supposed to help heal her trauma and not add to it. Opioids like codeine and morphine are strong painkillers, commonly prescribed for severe pains such as post-operation or during cancer treatment. However, they are highly addictive and can lead to people becoming dependent on them. This leads to them still needing the drug even if they stop being prescribed it, and can lead to people buying and taking opioids illegally. This increases the risk of trying other, stronger opioids like fentanyl, which are more addictive and carry greater risk. Since the 1990s, there has been an increase in misuse of opioids and opioid-related deaths for multiple reasons, many stemming from inappropriate or overprescription of these drugs. This has led to thousands of deaths worldwide. Pharmaceutical companies have repeatedly been fined and reprimanded for inappropriate or inaccurate advice being shared, including Purdue Pharma claiming its opioid drug, OxyContin, was safer and less addictive than other painkillers. False information like this leads to uneducated patients not knowing the real risks and potential harm from these drugs. If they are adequately informed on potential side effects and the risk of addiction, would they still agree to the prescribed drugs or look for other treatments? Alternative therapies, like physical therapy, are normally more expensive and have a longer onset of action compared to many prescription drugs, so patients looking for a quick fix are less willing to choose them. Therefore, if patients were allowed to choose their own treatments, they may not be willing to take approaches other than prescribed drugs. Additionally, because of this, there is now a lack of public trust amongst medical authority, leading people to self-prescribe or self-increase dosage. This can cause addiction. Lastly, there is a stigma behind addicted people that it is unlikely that they'll succeed in rehabilitation facilities, and therefore addiction is criminalised, as seen in Tyrone and Harry's storylines. Therefore, they enter the prison system going through withdrawals that could potentially kill them and likely give them access to prison drug systems, when instead it should be focused on treating them as human beings before holding them accountable for their criminal offences. However, the doctor's role is based on what they've been taught about the drugs. Is it more moral for doctors to present all the options and information and then just let the patients choose? Or should they involve themselves in the patient's care and decide what the best treatment would be?
Treatments for addiction. NA and AA are probably the most well-known treatments known for addiction. It is in many films and TV shows surrounding it, providing community support, accountability, as well as encouragement. Addicts are provided with a one-to-one sponsor who frequently keeps an eye on them, usually someone in recovery for a longer period. One of the issues surrounding NA and AA is that it often cannot be used alone and usually has to be integrated amongst other treatments. As well as this, lots of AA and NA step programs are centred around religion, which not everyone may be comfortable with, causing discouragement. Rehab is an inpatient or residential program that provides 24/7 care in a structured environment, allowing individuals to solely focus on recovery. Programs can be short detox stays all the way to therapeutic communities that can last between 6 and 12 months. These combine group therapy, medical care, and life skill training to give people options once they're out of rehabilitation. Medical detoxification is often the first step in addiction treatment and involves simply removing the addictive substance from the body safely whilst managing withdrawal symptoms. This may involve IV fluids, medications, and monitoring vitals. A negative of medical detoxification is the fact that it is physically harmful for the body, as well as a mental battle when withdrawing that the patient is likely to struggle with. Holistic approaches are more individual as they focus on mindfulness, yoga, exercise, nutritional counselling, supporting the body and making it healthy again to assist in recovery. This often complements medical and behavioural treatment, but is one of the further on treatments for addicts. Behavioural therapies are central to addiction treatments, helping to change attitudes and behaviours related to substance abuse. The most widely used talk behavioural therapies are CBT and DBT, group therapy, and motivational interviewing. Outpatient therapies are similar to rehab, however, treatment takes place in a dedicated setting that the patient attends around their existing life schedule.
Our argument for patient choice is that as long as there is full understanding and prior self-research done, then patients should be able to choose the best treatment to suit their lives. Medical professionals should present all the safe options for treatment and then let the patient choose what would suit them best. They can then choose a treatment that limits the side effects that would be particularly bad for them and find a treatment that would suit their lifestyle. For example, some patients may find sleep disturbance more of an issue than others, or may need a treatment that starts working immediately.